Hi guys, welcome back to another video. If you're new here, my name is Olive and I have recently been diagnosed with PCOS and endometriosis. If you do not know what these two conditions are, I'll just give you a simple breakdown. So PCOS, just as a simple breakdown, is having the ovaries of a woman. So when you think about ovulation, the woman, we release eggs, and that egg, if it gets fertilized, wouldn't have the baby. Now the ovaries are responsible for releasing those eggs. So with PCOS, you have enlarged ovaries, and the ovaries are not just enlarged, but you also have little cysts around it. You can think about those cysts as little balls. So one, it's already inflamed, it's enlarged, and then you have balls around it. Not good, especially when you're on your period. Endometriosis, the simplest breakdown I can give you is, with the uterus, you have linings, endometrial tissues that line the inside of the uterus. Now we have some of these tissues outside of the uterus, and it causes pain during period because it reacts to that hormone. Anyway, I'll give you a whole breakdown in another video. But yeah, during your period, when you have like hormones that are released, the endometrial tissue outside of the uterus also react to that, and that causes pain. So I've been experiencing really, really bad pain that personally I describe as worse than childbirth. I have also been having bleeding continuously. I do have my cycle, which is heavy, and there's a lot of clotting and all of that stuff. But even past my period, I'm also always bleeding. I've also had the hair loss, weight gain. I've gone 2 sizes up. I've got a lot of the symptoms of PCOS and endometriosis. So I do have a procedure happening today, and my gynae has advised that she would want me to stay in hospital overnight. So we're gonna pack my hospital bag together. I have everything here that's needed. So we're gonna pack and we're gonna go. I'm gonna keep you guys updated on how the procedure was. So I'll document through to hospital, I'll document after surgery, and also my healing process, 5 days, 7 days post-surgery, and I believe I'm back at work next week, Monday. So we'll see how we go, okay? So let's pack. So again, I've just got a tote bag, got that from Kmart, good old Kmart. I've got a towel. I like to take my own towel into hospital. Even if it's a hotel that I'm staying in, I like to just have my own towel. And also I've got cosmetics. So this is for overnight, so for tonight, and for tomorrow I've got everything that I need in here. All right, so in here I've got some sanitary pads. I've also got some panty liners, and I have also got some menstrual panties or undies. Now I'm packing this because I did not ask my gynae, and I didn't even look it up as well, just to know whether after the procedure I'll be bleeding. I'm pretty sure I will. I'm always bleeding anyway, but it's just the heaviness of it, so I've just got those 2 things just to cover me. And then in here I've just got my body mist, and I have also got my body spray. Girls gotta smell good. So just some body stuff in here, and all that stuff. And I've also got my robe and like a slip as well, like a dressy slip in there. I've got socks. Hospitals can get cold. I know we can turn the heater on, but I just like to keep my feet warm because I am cold if my feet is cold, okay? I'm just weird. And I've also got some bedroom sleepers. Now, with this procedure, I'm not quite sure, okay, but I'm pretty sure that I am gonna be, I'm personally, I believe that I will probably be sore. I know I'll be sore, all right? And I know there will also be a surgical site, a surgical wound site, and I don't want to put pressure on it, so I've got a dress for tomorrow. I'm pretty sure I'm gonna be very tender all down there, so a dress should do me fine. So I've got a dress for tomorrow. I've got some sandals for tomorrow to come home with, and to go to bed tonight I've got my hair bonnet. I've got a satin durag. I like to tie my hair and then put my bonnet on. I've also got some multivitamins, and I've also got some metformin. So my gynae put me on metformin because my fasting blood sugar was really, really high. I'm not surprised that it is because already I'm so over my normal weight gain. And I've also got a charger, gotta keep my phone charged. And I've also got my own pillow. I like taking my own pillow into hospital, okay? Pillow and towel I like to take into hospital, into hotel. Helps me sleep better. So that's that. And I'll show you guys what I'm wearing as well to hospital. I'll come back. So I've just got a shirt and some tie. I don't know how far, I don't know if you can see this far back. And I'm just gonna put on some slippers. And we're good to go. Oh, and I've got a hand sunny here, you know. So yeah guys, I'll see you guys in the other video. Bye. Hey guys, I said I was going to be documenting this, so I'm in hospital. I have gone through the admission process, I believe. I'll show you. I've got my wristband there ready to go. So I've got red wristband instead of white because I've got an allergy. So they're getting my room ready, and once the room is ready, the nurse would come and get us to go upstairs. And also my procedure is at 3:30 this afternoon, so now we wait, and that's how we over there. But yeah, that's just us. It's just a matter of waiting now, and I am nail by now. I was actually supposed to have something light this morning before 7, and then water only from 7 to about 9 a.m. But when I woke up, I wasn't really hungry, so I did not eat, and I just had some water between 8 to 9, and that's it. So surgery is in the afternoon at 3:30, so nail by mouth since this morning, so I'm going to be really hungry. I think I'm starting to feel hungry already, but it's okay. I'm alright. Alright guys, I'll see you guys in the next week. Hi guys, so I'm currently being prepped for theatre. So obviously clothes are off and I am in some hospital gown. My bag is pretty full. My legs will not fit in because I have not got the casing. I forgot the casing at home in my study. So the nurse has suggested that I take the lens with me to theatre, and what they'll do is they will bag it and they'll hang it up there, and that way it will come with me back to the ward. So that's where we're at right now. And oh yeah, I did get some socks this morning. I was a bit concerned, you know, because I'm a cold frog. But yeah, obviously going to theatre, I did get some socks and some very warm blanket. I do feel bad for Happy though, because he's come from night shift and picked him up, and then we've come straight into hospital. Once he eats, he'll be fine. But yeah, so that's where we're at. It's about 2:30 p.m. right now, so not long to go now. I have about an hour to go. So I'm just gonna rest it, and I will see you guys in another video. Bye.
Your earrings, are you okay if we put some tape over those?
My earrings?
Yeah.
Absolutely.
Do you have any other jewelry on?
No, I keep them all off. Thank you.
You can tip her up down. Yeah.
Hi, now it's getting serious. Well, it's always been serious. So yeah, we're getting ready to go now. So my earrings are all taped. I've got some tight stockings at the bottom there with some scarves on. So the oddly is here to take me into theatre. So I'm gonna put my phone away now And the next time I see you guys will obviously be after surgery.
Hey guys, I'm back on the ward. I've just got that towel there because when I do cough, it's very painful. So I just apply a little bit of pressure. I've got a hot or a warm towel at the bottom in my tummy, and I've got, I think, 3 surgical wounds, surgical sites. I got out of theater at 5:30, but then I stayed in recovery till 7, and I got to the ward about 7:10. I was really sedated. And yeah, hubby is on his way here, and dinner is coming up as well because I'm very hungry. My mascara smudged, but that's okay. I'm okay. Surgery went okay. I'm gonna be seeing my gynae and just to know how everything went. I'm just really sore, but I'm okay.
Hey guys, good morning. So it is day 1 post-surgery, and I am still in hospital. I don't know if you can tell, but I look better and I feel better. So yesterday the surgery went okay. I was in theater for 2 hours, so from 3:30 p.m. to 5:30 p.m. When I woke up in recovery, I was really drowsy and I was in lots of pain as well. So they gave me a low dose of fentanyl. That knocked me out. I was in recovery for about an hour and a half, from 5:30 to 7 p.m. Pain management, and obviously they had to do other assessments on me as well, just to make sure I was stable enough before they brought me up to the ward. So we left recovery at 7 p.m., got to the ward at 7:10. I was really hungry. The nurse assisted me to order dinner. So breakfast, lunch, dinner in this hospital is we order. So it's a private hospital, and yeah, it's an ordering service, catering ordering service. So I sat in bed and I had dinner. Hubby and Bob came over to see me. My daughter was a bit emotional. She kept saying, "Mommy, Hetty." Her eyes were wide open. Not saying I think she was thinking it, because when she walked in the room, like her eyes were wide open, and she opened her mouth like, and then both her hands on her chest. And she won't even come to me. Even when her dad tried to put her next to me in bed, she did not want to. So I think that was a bit emotional for me, so I didn't include it in the video. And just spent some quality time with them, and then they went home. And after they left at 9 p.m., I felt like I wanted to do a wee. So guys, you should never, ever, ever post-op try to get out of bed on your own. When you have a procedure or a surgery, no matter how fit and awake and alert you are in bed, especially for that first getting up, always make sure you call on your nurses, because a lot can go wrong very quickly. So at 9 p.m., I'm feeling like I don't want to do a wee. So I called for the night nurses, and then my nurse came in. She saw me. She was like, She called for another nurse and said she needed a hand. I was so drowsy the minute I woke up. I just wanted to, my eyes were closed at this point. I kept going back and forth. I wasn't stable on my feet, and I wanted to rest on the other nurse's shoulder. And, they kept saying to me, Olive, please open your eyes. Just keep talking to us. So one person just held me, and the other quickly rushed in, got the camo chair, sat the chair next to onto my bed and sat me in it to do a wee. And then once that was done, she quickly put me back in bed. While in bed, I felt so nauseous. That's the word. I felt so nauseous. So they gave me a vomit bag. I'll show you. Gave me a vomit bag, and then also just this natural flavored Sprite, but it's also got lime in it. It's like lemon lime. Anyway, so they gave me that to have, which was good, but I started wanting to still go, and I had lots of water as well. I started wanting to still go in the MSS bag, and then I asked if I could please have some Discharge, and she was like, yep, sure, we're gonna give it to you intravenously just so that it works quicker as well. So they did that, and that was good because I didn't end up, puking. That resolved the issue. At midnight, I felt again that I wanted to do a wee, so I called for my nurse, but she was already here to do a set of obs on me, which is like checking blood pressure and all of these things. So she came in, and she asked if I needed assistance, and I said, yeah, I want to do a wee, but I think I should be fine. She wanted to hold me. I told her, no, don't worry about it, I think I'll be okay. So she just stayed with me, and I wasn't as dizzy, so I held onto the door because obviously I felt a little bit weak, and then held onto the pool in the bathroom, and then did a wee and came back to bed. This morning I got up, did a wee again by myself. I felt a lot stronger than I did at midnight and at 9 p.m. So yeah, that's that. I'll show you my surgical side as well. Pain-wise, I'm actually okay. It's just sore. I'm just really sore. I've also got this heat pad here, which is really good. It's working wonders. I try to show you my surgical wounds or surgical sides. So it looks like one or two of them is a bit oozy, so that's the clean one. And the one on my belly button there, that's oozing a little bit, and there's one just down there that's also oozing a little bit. So that's that. I feel okay. I want to have a shower, but I don't know, when I get up, I feel a bit weak. So I might sit on the chair in there and then have a shower and come out, or maybe wait for hubby to get here and then have a shower. This morning I have ordered for breakfast because it's a room service, and that should take about 45 minutes to get here, and I'm also hoping that I will be discharged today, so I want to try and get ready so that after breakfast and when it's discharge time, I'm ready to go. Last night I could not do my nighttime routine. I asked the nurse to help me get my cosmetic bag. She did. She put it right next to me here, and I passed out on it. So I guess she put it back over there. But yeah, this morning I have to actually, because I need to. I feel like my face is a bit clogged up. I think that's because I'm so used to my morning and nighttime routines, but that's okay. So yep, this is the one, and like I said, I will keep documenting my recovery journey, up to 7 days. Post surge, and I think day 7 is when I actually go back to work. If you don't already know, I'm a registered nurse myself, so when I do go back to work, I will be on light duties for 6 weeks. That's what the gynae has advised, because they don't want the surgical sites to burst, because then that could turn into hernia. So they just want me to be on light duties for 6 weeks so that I could heal and heal properly. So that's it for me for this morning. I'll let you guys know how I go throughout the day. All right, see ya. Breakfast is here, so I'm gonna try and eat something really quickly. Hi guys, so I have had breakfast. I'm feeling much better, more alive. I did ask the nurse if it was okay for me to get into the shower and have a shower, but she wants me to wait for her, and so she could help me into the shower after my 8 a.m. meds. Now, even though I'm full of energy and things in bed when I get up, I'm moving around okay now, but I'm still a little bit weak, and I need to move a bit slower. But yeah, so I'm just waiting for her now to help me in, and then I'll shower and get dressed. and start getting ready to go home. And also, I know I was a bit concerned and I didn't know whether or not I'll need a pad or a liner, and whether or not I'll be bleeding, because obviously I forgot to ask my gynae and I didn't have time to look it up either. So yesterday I did see blood and I did have a pad post-surgery. And I also noticed a bit of dye as well. So I know that she did go in there and try to scrape out some of those endometrial tissues that were outside of the uterus. And I also know that she did flash in as well with a bit of a dye, because I did see that as well on the pad. But what I've noticed between 9 p.m. to this morning is a decrease in the amount of blood. I'm just going to use a liner after shower, because it's really very extremely tiny blood at this stage, because I went in and did a wee again not too long ago. So yeah, I guess I'm just waiting now 8 a.m. meds, and then the nurse will help me out into the shower and I can shower and get dressed and get ready to go home. I'll see you guys in another video. Hey guys, so I'm all showered up and I'm ready to head off. So in a dress, like I said earlier, pharmacy has also been in. They've brought up drop off my medication, just got some Endone and some other stuff in there. I'm also going home with these hip packs, so for my tummy and also my shoulders, obviously because there's a nerve that connects down to my tummy area. So sometimes when there's a bit of air movement or stuff happening down there, I do tend to feel the pain up on my shoulders, so I've got those for that. But yeah, so the one post-op, I'm gonna sit. I feel fine. I'm just waiting now for hubby. He's downstairs. He will be up here. And I've also got some Tangadem. So you remember that I showed you the oozing on the surgical side. The nurse came in and she changed it, but then I've also got some spares. They're grabbing some more actually. So just in case it oozes at home, shouldn't, but if it does, then at least I've got space to actually change it. So I'm feeling really good. Hubby's also here. So he's ready to take me home. I feel good. So day one, post-op. Thank you, honey. Oh yeah, I'm gonna my hip part. It felt. Ooh, this is gonna be tricky, but
yeah.
Okay.
Let me treat you. Hospital treatment. Executive treatment. Are you right? Are you okay? Is there anything we can do for you?
These are funny ones. I'm gonna put this hip patches back here.
Okay.
Because I'm a bit cold anyway. I mean, still a bit sore.
Oh yeah? You sore?
No, it's just I'm not in pain, but obviously it's gonna be a little bit sore. So I just put